So for our first question, Dr. Tomsic, why don't you give us a quick introduction about yourself and how you got to where you are today?
Absolutely. So my name is Dr. Jaclyn Tomsic, and I am an oral and maxillofacial surgeon. I practice in Cleveland, Ohio. I am board certified. I am full-time working in a private practice setting, as well as part-time academic faculty with the Case Western Reserve Oral and Maxillofacial Surgery Residency Program in University Hospital's health system. To become an oral and maxillofacial surgeon, for me, took about, in total, about 16 years, including starting with undergraduate school. So I went to a 4-year undergraduate school. I majored in chemistry, minored in biology, which is pretty common for anyone in a pre-healthcare field, though it's important to note that it isn't required. You can have a non-science-based major. But after undergraduate, I immediately went to Boston University for dental school. I completed 4 years of dental school. At the end of my dental school, I realized that I really wasn't too into dentistry per se, in general dentistry. I really had a passion more for medicine. And instead of just going to medical school altogether, I was introduced to oral maxillofacial surgery, which is a really nice blend of both dentistry and medicine, included going to medical school. So I kind of pivoted and decided that that's what I was going to pursue. So since it was kind of later in my dental school years, like my 4th year, I did a 1-year transition year. I did a hospital-based dentistry residency program, where with a full intent of going to oral maxillofacial surgery. And luckily it worked out. During that year, I did apply for the oral surgery cycle for the following year, and was very lucky and happy to have matched into a program. So I matched into a 6-year oral maxillofacial surgery program in Detroit and Wayne State University. So that program is called an integrated program, which means it integrates both your residency training as well as medical school. So during that 6-year period, I attended the 2nd, 3rd, and 4th year of medical school, and graduated in 2010 as a medical doctor. I then did a 1-year residency internship in general surgery. And then scattered in between all of that, a 6-year total, I also completed my oral surgery residency training program. So it's a long time, but also a very short time, because a lot is packed into the 6 years you were there. After spending 6 years in Detroit, I then I could have just gone out and opened my doors and been an oral surgeon, or joined a practice, or staff at a hospital or residency program. But I decided that I wanted to complete a fellowship. So fellowships are optional. They're usually 1 year long. So I actually did 2 separate fellowships, but I did my first fellowship in DC at Georgetown, focusing on what is called orthognathic jaw surgery, complex dentofacial and craniofacial deformity, and sleep apnea surgery, before I finally took a job in St. Louis, where I worked there for 5 years, before circling back, coming full circle, and returning to my hometown of Cleveland approximately a year ago. So that's where I am now. And like I said, I not only work in private practice here, but I also work with our residency program here in Cleveland. So.
Wow, that's amazing. 16 years, that's amazing. So now could you please give us a description about your day-to-day experiences in your field and what a normal workday would look like for you?
Sure. So my day-to-day, I work 5 days a week. And like I said, I am in full-time private practice. So I work on average 3 to 4 days in my private practice office, which includes seeing patients usually from about 8 to 5. So like today, actually, I was in the office till almost 6 o'clock. So I rushed home to get on here with you guys. So I'm glad it worked out. But so I see consultations in clinic, I see follow-ups, and then I do minor, what I call minor procedures that we do in the office. And we do administer sedation and anesthesia in our office. Most of our office procedures, things, for instance, that we do include removal of impacted teeth, third molars or wisdom teeth, pathology, just some very small pathology or oral biopsies, to plan other surgeries, consultations for jaw surgeries, consultations for trauma surgeries, and then we do a lot of dental implants in the office. So like I said, I do that pretty much 3 to 4 days a week. The other 1 to 2 days a week, I'm either in the operating room doing bigger cases, as well as teaching and staffing the oral surgery resident clinic with our residents. So I have a pretty busy week, but it is honestly a pretty, it's pretty predictable. I work pretty much 8 to 5 most weeks. I do take call. That's part of what I do with the residents. I take trauma call with them at a level 1 trauma center. I share that with 2 other oral surgeons in the community. One of them is my partner, and then one of the other surgeons who's affiliated with our program. So between the 3 of us, we rotate trauma call. So that means I take call on average 2 weeks out of every 4 to 6 weeks. So for instance, the day or the weeks that I am on call, I often have longer days. So I very commonly could work all day in the office from 8 to 5, and then go straight to the hospital after work to do, for instance, like a trauma case that came in the night before or a couple of days before. And sometimes also during trauma weeks or call weeks, I will also operate on the weekends. But again, that schedule is made ahead of time. So I have plenty of time to plan, my other aspects of my life, social life. So really, for me, I like the variety. I do like to be in the hospital, and I like trauma. So to me, I would, my job wouldn't feel complete without that aspect of it. So I think it's a great work-life balance. And it really is, can be what you make it. So I have been lucky enough to be able to make it something that I really enjoy doing.
Thank you. And I'm really glad that you touched on the work balance in your career, because I know it's a common issue where people are stressed about going into the field because of balancing everything out. So thank you for touching on that. So within your journey to how you got to where you are today, were there any major challenges that you had to overcome? And if so, what were they and how did you overcome them?
So there are a lot of major challenges. I think the biggest challenge is, really during residency, you're really pushed. I don't want to say to the edge because I don't want to sound like really drastic or anything like that. But, residency is tough, and a surgical residency is very tough and demanding. But honestly, any residency, no matter what specialty you are, it is very demanding. They've done a lot to alter and improve the work hours for residents. But you still work 80 to 100 hours a week. I mean, that's a resident life, that's expected. And like, obviously that's very demanding. So you really have to figure out your successful form and way of time management. So I really had to do that. I joke that by the time I finally, my third time around, or my third, higher education. So I went to undergrad, then dental school, then medical school. So by the time I got to medical school, I finally learned how to manage my time better. So it worked out for me, because then that also translated into residency. So, really achieving good time management so that I could get done what I needed to do, as well as give yourself that, self-care and time off was a big accomplishment that I was proud that I made it through. Some people don't. And then, of course, to touch a little bit on, the demands of a surgical residency, both just in general and as a female, there is some stigma around that. Luckily, it's, being more and more accepted and encouraged. My specific specialty is still very, very male dominated. Even statistics up till last year said that, there's only about 15% of my entire specialty is females. And only about 20% of residents are females. And the two main issues that most people will cite as kind of deterrents for that is, of course, for pursuing surgical specialties as a female is, of course, the time commitment and starting a family and having a family life. Now, my personal experience during my residency did not include a family. I was not married at that time, so that really didn't factor into it. But I trained alongside many fellow female surgeons in not only my specialty, but other specialties that were married, that raised families. Even one of my attendings during oral surgery residency, another oral surgeon, she was a single mom during residency and as an attending. So you need support. You need to find a good support system, both within your residency and your personal support system. And I would say that's one of the most important things. If you're going to pursue this, you want people behind you that they don't necessarily have to be in medicine or healthcare, but they just have to be supportive of you and your journey. And just because if you have a support system, and if this is truly the right thing that you want to do, and you love your job, which, believe me, when you're spending this much time in a field, you will know that it is right for you. So if you have that passion and that support, then you'll get through it. So I hope that answered the question. I kind of got off a little bit. But.
No, it totally did. The advice was great to hear. So we have one last question before we start the Q&A session. So the question is, what information do you think that high school students should know before committing to this career path?
I don't. So honestly, as a high school student, I had no idea what I wanted to be. And no one in my family was in healthcare. My mother was an educator, so she was a teacher and then went on to become a principal. My father was in psychology and career studies. So, and I had no healthcare doctors in my family, but they just suggested that I look into becoming a doctor. At the time, I knew a couple dentists, so that's why I kind of went towards dentistry. And so when I was in undergrad, I applied to dental school. I was in a pre-med track. It was the same. So pre-healthcare, it was called pre-health sciences, either dental school, medical school, nursing, whatever. So we all took the same classes. And like I said, I got into dental school. I mean, I didn't dislike dental school, completely enough to quit. But I just realized it really wasn't my passion. And I was, really, I have a passion more for medicine, but at the same time, I had put all this time and effort into dental school. Did I really just want to quote unquote throw that away? So a roundabout answer to that question is, in high school, I wouldn't say, if you're interested in healthcare, I would say shadow as many people as you can. Obviously, unfortunately, right now we're in a time that is kind of unprecedented with COVID and everything. So the in-person shadowing, isn't as available. I'm very hopeful that this time next year that won't be a problem and we'll be back to, normal. But that's not to say, though, that there isn't in-person shadowing available even right now, because I know personally, in my practice, we have students come and shadow us because we're operating full time. So we welcome students, and it's just like anything else with the precautions. But so if you're interested in healthcare, find doctors in your community. It doesn't necessarily, like, say you think you want to be an orthopedic surgeon. If you can find an orthopedic surgeon to shadow or to speak with or to mentor you, that's great. But it doesn't have to be. Just somebody in healthcare. And actually, sometimes it's better to get a variety of different opinions on people's experiences are all different. So it's good to know. And honestly, volunteering with, it doesn't have to necessarily be related to healthcare, because so much of medicine, whatever kind of doctor you are, has to do with just relationships and people skills. So they want, any kind of, even undergraduate school, but especially like graduate professional school, medical school, dental school, they're going to want to see you have good people skills. And any volunteering community effort or opportunity is going to give you that. So those, I think, are honestly just, you want to be involved, you want to be an outgoing person, you want to show that you're motivated and you're dedicated, and you're responsible. Responsibility is huge in any higher education, but especially if you want to be a doctor. I mean, people are going to rely on you for your life, or being put in your hands. So you want to start developing those skills as early as you can. High school is a great time to start, as well as just, communication skills, just, with people, because again, there are obviously some specialties within medicine where you communicate less, for instance, radiology or pathology with people, than, my specialty. I see people obviously every day. But no matter what you do, communication with patients is going to be part of your life. So getting those kinds of skills early, I think, is invaluable. And then, of course, strive to get, good grades. I mean, and also trends. Think about trends, because a lot of people, maybe start out, they don't know what they're doing, or not that they don't know what they're doing, they don't know what they want to do. So maybe their grades are, just average. Then they decide and say, hey, kick it into gear, I want to be a doctor. So trends are important too. If you trending upward, obviously, is going to look a lot better than the opposite. But
Thank you so much for all the advice and the really in-depth responses to mine and Vanchika's questions. Really great way to start the meet. But now you guys have heard enough of mine and Vanchika's questions. Now we're ready to open the floor and move on to the Q&A session.
I had a question. So what would be the main difference between you, and a plastic reconstructive surgeon that would do jaws?
Okay, that's a great question, actually. So my specialty, which the full term is called oral and maxillofacial surgery, along with plastic surgery, along with ENT, ear, nose, and throat, which is also synonymous with otolaryngology, our three specialties have a lot of overlap. In turn, we are the three main surgical specialties that treat conditions of the facial skeleton. So many of us, like I said, are qualified to do many of the same surgeries. So facial trauma is definitely one of them, just because, there's a lot of it. So we do tend to, share with those specialties. I think, did you ask specifically about jaw surgery?
Just in general, because I've shadowed plastics and I know that they did it, so I didn't really know what the main difference was.
Sure. So I would say, and I'm sure most plastic surgeons as well would say, that oral and maxillofacial surgeons, we hands down do the most orthognathic surgery or jaw reconstruction surgery, mainly because of our dental background, because it is a dentofacial deformity and it includes collaborating and working alongside an orthodontist. to prepare the teeth through braces. So both plastic surgeons and oral surgeons are qualified to do the surgical part of it, which is the jaw surgery, the jaw repositioning surgery. So we're both duly qualified and trained in doing it. Because of the nature of our specialty, like I said, because we have the dental background, we've gone to dental school as well as medical school, we just tend to do it more than plastic surgeons. A lot of plastic surgeons will focus, they have a lot of other focuses, obviously, other procedures. I mean, some plastic surgeons will specialize mainly, won't even do anything in the face. They'll do mostly body, or other structures, but we have a little bit of different in I think our surgical approaches to doing the surgery, but like anything, there's many ways to do it. And again, I say this, I mean, my best friend is a plastic surgeon, so I have no disrespect for any plastic surgeons. I do feel like, as with our dental background, we do have a little bit better eye for making sure that the bite, or the way the teeth come together, is more successful in the jaw surgeries, just because, again, we have that training and that background. But again, like I said, in many communities where maybe rural areas especially, but also in major centers, there's a lot of people, there's a lot of cases. These cases are definitely more common than you would think. And so there's plenty of surgery to go around. So plastic surgeons are also able to do it. I will say one final thing, that a lot of plastic surgeons, again, just choose to focus on other areas of plastic surgery, even other areas of facial plastic surgery. And some of them do refer out even to us. But some of them also choose to do it themselves, and that is totally appropriate as well.
Thank you so much.
Sure, that was a great question.
All right, so for the next question in the chat, they're asking, when you were deciding colleges after high school, what was the most important thing to you and what that you were looking for? What was your rubric?
So I went to college. I grew up in Cleveland. I went to a small private university here in Cleveland as well. When I was applying, I applied to both big schools, big universities, state universities, as well as a number of smaller schools. If I remember, and it's been quite a while, but I probably applied to at least about a half dozen schools. For me at the time, honestly, it was the fit for me, and not so much. I wasn't looking for, some people look for, they want to be an engineer and they have a really good engineering program. If you're looking into sciences, like most schools have a pretty solid health science program. You're going to get a good education as long as you perform well in your pre-med or, health science classes. You're going to be very competitive in any medical school, dental school, or veterinary, or any other school that you apply to. So for me, deciding upon an undergraduate school was more my comfort level. The type of school that I wanted, I decided that, I applied to Indiana University, which is a huge, state school. At the time, I think they had like 20 or 25,000 students, and I was overwhelmed. I wasn't ready for that. So I decided to attend a smaller, like I said, private university. My university is named John Carroll University. It's here in Cleveland. It was only about 45 minutes away from where I grew up. I did live on campus, though. That is one thing that, I wanted to do. I recommend it. I think it's an experience that is very valuable for life. But it was a smaller environment. And I just felt more comfortable with it, and I was able to grow. And for me, it worked out very well because, like I said, it was a small university. I spent 4 years here, and at the end of my 4 years here, I was definitely ready to move on. And so that's when I moved. I was determined that I was going to leave the state of Ohio, which I did. And that's when I went to Boston University, which obviously is a much bigger school, and obviously a bigger city as well. So for me, it was more my comfort level. And if you want to succeed in healthcare, I will say, to me, I think that's more important than saying is you're comfortable around school in an environment that you can succeed. Because it doesn't matter, say you get into Harvard or Vanderbilt or a very high profile name school, but you go there and you have mediocre grades. You can't get into professional schools just by a college name alone. If you don't perform well, you're probably going to have, the same kind of struggles. So go to a school that you feel comfortable with, that you really like the field, you really like the campus, you really, like the programs that they have or the extracurriculars that they have. Maybe you have friends there, maybe you got a good vibe where you were there. Those to me, your environment is a big part of your success. So that is what I would look for. That's what I ended up ultimately choosing when I chose my undergraduate school. So that would be my advice on choosing an undergraduate school.
Okay, so the next question is, what do you do if you do not know something or how to treat a certain patient, or you are faced with similar cases, or are you faced with similar cases often?
Well, obviously, we're pretty much faced with, cases that we do often, in similar cases very often. But of course, it's kind of hard to understand this or even, kind of explain it to other students during residency, or especially when you're in residency, to understand, like, how can I do surgery? How can I perform a procedure that I have never seen before? Or I never done before in residency? Because believe it or not, like, I spent 6 years in residency and there are still cases that I did not see because that's just the nature of medicine. But one of the main things you learn in medical school and in residency is evidence-based medicine and critical thinking. So you are given the basics. You learn. The importance is to learn the basics of surgical technique, the basics of your basic surgeries. So all the surgeries that I see most commonly are surgeries that I did during residency, because they're the high volume, the most common procedures. So, it's not hard to get exposure to those procedures. The zebras or, the kind of oddball procedures that are less common, I may not have seen them in residency, but I was taught and I learned how to approach them. So I do this every day. I mean, there are still, cases that maybe I've seen, and there's like a little aspect of it that's a little bit different that I haven't seen before. So I look up articles on cases all the time and read different, say you've done something, procedure the same way for many years, and then a new technique comes out. So you learn about that technique and maybe you try it. And the more you practice, I had an attending once tell me that you learn more in your first 2 years out of residency than you do in your entire year of residency. And, as a naive, just, silly resident, I just was like, okay, whatever, yeah. But then, now looking back, I can see how true that was. That couldn't be more true, because you learn how to take all of the information that you're cramming in your head for 4, 5, 6 years, however long your residency is. And then you learn that you really do know a lot, and then you learn how to apply that. So, which is also honestly one of the things that makes, any career in surgery or medicine or dentistry or anything really fun, because things are always changing and you have to kind of evolve and keep up with it. Otherwise you'll get left behind. So you will always know how to do something, believe it or not, even if you've never done it before, because you know how to read about it. And even if the steps are different, you have done all of these steps separately in other procedures. Now you just bring them together in a different way in a new procedure. So, and again, to me, that's one of the things that makes medicine and surgery so much fun, because no two surgeries, even though I can do, dozens and dozens of mandible fractures or jaw fractures, no two fractures are the same. No two cases are exactly the same. So it's fun.
Great. So our next question is pretty relevant in what we're living in now. So in your field, in OMF, what are the most significant changes caused by the COVID-19 pandemic, and how do you think those changes will affect our generation's experiences in the field?
Well, I think the biggest change is the reluctance of people to seek care, especially elective care. And, that obviously has been a big problem in many fields and more detrimental in a lot of other fields, like, for instance, primary care, where people don't seek treatment when they need it for, their underlying medical conditions, heart, lung, cancers, different things like that. So I think that that's been the hardest thing to overcome. I feel lucky. Our community is pretty much back to normal. Most people are seeking out the care that they need, especially, the urgent care. But even during, the non-elective, when it was just emergency cases, which we were doing. So we never closed completely because there's a lot of emergencies that still needed to be treated. But it was, difficult, and you really had to convince people that, this is something that cannot be put off in those situations. Like, you need to come in, you need to, we're here for you, you need to get treatment. So I think that was the biggest obstacle. Obviously, going forward, things are going to be different, but at the same time, I think a lot of things are going to be the same, because for us, especially in surgery, sterility is our life. Like, we live in sterility. Like, we do surgeries every day in sterility. So when the big, push for cleansing everything and sanitation came along, it kind of was like, not really much different for us, because that is our everyday life. Like, and I would always say to patients or people, like, I would kind of question, on normal days, if you went in and your doctor's office was like dirty, like, I wouldn't want to go there on a normal day, let alone in the midst of a, pandemic, where we're worried about, extra worried about spreading germs. I mean, germs are there all the time. So in that regard, for us, I don't think that's going to be much of a change. I mean, it hasn't been, because we do it already. But in other aspects of life, that's something that I hope will last and will be a permanent change. Possibly is higher sanitation and just higher knowledge and thinking of, if you are sick, then you should stay home. And I myself am definitely guilty of that, because as surgeons, as doctors, doctors are the worst patients. Like, we may not feel great, but, we have a whole day worth of patients. So, we got to push through. And so now even myself will second guess that, realizing that, it really, even though I think I don't want to, reschedule 20 patients that are scheduled and expecting to come in and see me today, it's better if I really, truly am not feeling well, and I'm sick, then it is better for my patients to do that. And I hope that that is something that everybody will kind of critically think and hopefully be more understanding about going forward.
Okay, so the next question is, if you were a sophomore in college today, given the conditions, what would you be doing now, knowing what you know from your experience?
Well, as a sophomore in college, sophomore's a pretty fun year. I would probably just be having fun. I don't think you don't even have to really apply to anything, I don't think, until like senior year for like medical school. I would just be focusing on, like I said, getting good grades, in your classes, whatever classes you're taking. I mean, when I was in undergraduate, I was a chemistry major and a biology minor. So, I mean, I took 15 to 17 credit hours every semester. I mean, and I went to a liberal arts school, so we had other requirements for graduation for, credits and whatnot. So, I mean, I was always pretty busy. Like I said, having a good GPA, having a good transcript is the best thing you can do for yourself to allow you to have as many doors open as possible. Not that, again, like I mentioned this before, people, maybe you're a sophomore and you never thought of medicine or surgery or anything until, this semester, and you're like, man, I just shadowed or met this, eye surgeon, and this is it. This is what I want to do. So you can do that. Okay. It's going to be, if you have to pivot, some people do, if their grades are really bad, they have to do like extra master's programs. They do that in between undergraduate and applying to a professional school, to step and to show that they can achieve those grades. But, so as a sophomore, just, really focus on doing well in the classes that you're taking, whatever they are. And, also, having a diverse life outside of school as well, a healthy one, like be social, if you're into sports, you don't necessarily have to be a varsity athlete when I say that, but be involved in other programs. There's so many different extracurriculars in universities and colleges these days. Form a good, solid, group of friends, and, just enjoy your college life, because I can say that is the one area of school or life that if I could redo again, it would definitely be college years. So, you just find that happy balance. Like, don't party all day, because that's obviously going to be detrimental, but also, get your head out of the book too. You don't want to be in the book the entire time, because that's detrimental in a different way. So diversify yourself, maybe, is what I'm saying.
Great. So our next question is, so during your undergraduate school, or when you're studying pre-med, were there any specific stories or memories that stuck with you through those years that got you through the pressure?
The pressure of just undergraduate, or the pressure of applying to school, or?
I guess everything combined, like the weight of studying medicine and the academic overload and everything like that.
I don't really have some defining story that comes to mind, honestly. My biggest accomplishment throughout all of my different phases of life, I call them phases, like my undergrad phase, my dental school phase, my medical school phase, my residency phase, of just the relationships that I developed during those times. I still have, great friends that from each phase of my life that, of course, I don't talk to every day anymore, not like I did when we were in the same place in the same time together. And of course, back when I was in undergraduate, there was no Facebook or Instagram. So we had email, which was really only used to like email assignments. So we didn't really like it that much anyway. But now, obviously, with all of the social media platforms that we have, it's a lot easier to keep in touch with people. So I think that's great. I've really loved that aspect of it. But yeah, so I don't have, like I said, a defining moment or defining story. I just feel like I really did a great job of making defining friendships and relationships that really were enriched my life and enriched my experience and allowed me to, pursue what I wanted to pursue and ultimately achieve my goals.
That's really good to hear. So I have one question. Was there anything that you were scared of during your journey? Because you had a very long journey, like you said before, it was 16 years. And did you ever feel like lost or you were losing motivation? And how did you get back from there?
Honestly, believe it or not, I didn't ever lose motivation, because I knew that I knew that the end goal would be worth it. I had mentors that were good mentors because they said, you know, this is a great career. I could see that they were happy and that they really loved what they did. So I knew that if I stuck it out, I could have that, and I do. But I mean, I say this all the time. Like my residency and medical school years, so that was a 6-year period of time. And I remember when I was in dental school in Boston, at one point I remember saying I would never become an oral surgeon because I would never go to school for 6 more years. That's crazy. And then like about 2 years later, I said, I want to be an oral surgeon and I want to go to school for 6 more years. So it was really an evolution because what happened between that time was I realized like I really loved this material. I really loved this field, this specialty, and I wanted to learn it. When you're learning something that you really love, I mean, that's your motivation right there. Medical school to me was just amazing. I loved medical school. I loved learning about medicine. So I never, it was never really a burden. Like I said, by that time, I finally learned how to study the best. I did the best because I knew how to study and prepare the best. But I really liked what I was learning. When you like what you're learning, like I'm telling you, the time goes by so quickly. So 6 years went by in like a flash and I couldn't believe it. And then I was faced with figuring out like, oh my gosh, now I have to get a real job. So of course I delayed that by doing more fellowships for a couple years. But again, I think the biggest discouragement that I had was not so much the end goal, but there's always going to be haters along the way. In whatever you do, for sure, for whatever reason. So I had to face that during residency, and that was difficult. And at times I was very discouraged. But my biggest way to deal with that is just, I was very good at detaching. I was able to detach and do things that had nothing to do with medicine or surgery, and kind of refresh so that then I could come back and, get on the horse again and get through it. Unfortunately, I wish I could say that those people won't come along, but there always will be, haters no matter what you do. And my best advice is just to try, and there's going to be those people that unfortunately you're not going to be able to completely avoid, because that would be the easiest, is just avoid those people altogether. But you're going to come along people that, you're attending, or they're your program director, or whatever they may be. You have to have a relationship. You have to have contact with them. I guess the way I got through it was knowing that there was an end, and there was always an end in sight for residency. It's a finite period of time. So if you can just get through that finite period of time and do what you need to do, then after that, you can never talk to those people again. And I can assure you, there are people that I never talked to from residency because they did not add any positivity to my life. So I kind of got off on a tangent. I don't even remember the question at this point, but I hope that answered it.
Yeah, no, that was great. Thank you so much. So we're reaching the end of our meet. I'm just gonna see if anyone else has any more questions, like in the next 30 seconds, drop something in the chat. Until then, Dr. Tomsic, do you have any last or final thoughts you wanted to leave? Anything you didn't touch on?
I mean, I just congratulate and encourage every single one of you for, just being here, because right there is a sign of dedication, a sign of, responsibility, by taking that initiative. So I just encourage you to continue and to pursue your dreams, and also don't beat yourself up about it, and realize that your dreams can definitely change and your goals definitely can change. So don't be discouraged about that. if you realize that all of a sudden maybe medicine or healthcare isn't where you want to, lead your life lead or your career to lead, that's okay. Because there's so many things that you can succeed in life. So just stay positive. I know it's been hard, especially this year. Myself included, it's been a crazy year. It's been hard to stay positive. It's been hard to be normal. I truly, believe that we will get back to a normalcy where social interaction is normal again, which to me is one of the hardest things, honestly, because humans are social people. We're social beings. We need each other, and not just in a video or a phone screen. As helpful as that is, we need really a real, true in-person interaction. So just stay positive, and the only other advice I could give is, truly keep toxic, negative people out of your life. You don't need them. They don't add anything to your goals, so do not feel bad about, having to break up with people, in that sense, or, dismiss them from your life, because, the only person it's really committed to you ever 100% is you. So if someone's not, like I said, adding any positivity or benefit to your life, and really rethink, you may not need them in your life. So, and then, reach out to me, myself, if there's anything that if you come up with questions, it always happens, afterwards, please, I'm happy to answer any questions, or anybody, like I said, to find somebody in your community. And I can say that about, any doctor, but any person really. Everybody loves to talk about themselves. Everybody loves to share their career because you like what you do. So most people are going to be more than happy if you go up to them and say, I'm really interested in what you do. Can I talk to you about it one day? Most people are very honored to have someone ask them that. So don't be scared to take that step.
Well, Dr. Tomsic, we feel honored for you being here with us today. Thank you so much for all the inspiring words, the thoughts, the advice. Awesome. Thank you.
Well, thank you guys, and congratulations. I really respect and admire, these types of groups that you guys have organized. Again, that's very impressive.
Thank you. That means a lot. And thank you for everyone being here today. Once this meet ends, you can view the recording under Virtual Meets Library on our website. And if you have any friends who can come, you can just direct them right there. So yeah, that's great.
And if you guys could help us out, and if you guys know any other health professionals that may be interested in conducting a virtual meet with us, because as Dr. Tomsic mentioned, they love talking about their careers, you can have them email us at risingmedicalleaders@gmail.com or reach out to us on social media.
Yes, and once again, thank you for being here, Dr. Tomsic. Your advice and your experiences were amazing to hear about, so thank you.
Well, it's been my pleasure. I wish you all well, and everybody have a great evening.
Yes, thank you.
Thanks.
Thank you. Bye, everyone.
Bye.